The Steve Gill Show.
Hey, welcome back in. We're talking health care. The Obamacare repeal goes through in the House. Now it heads to the Senate. Will they even bring it up for a vote? Mary Mancini is in with us today. She's executive director of the Tennessee Citizen Action Organization, TNCA.org. They focus on a lot of issues in the state of Tennessee, but health care and expanding health care. And as we pointed out, I don't think there's any real disagreement on we want to improve the quality of health care and the affordability and accessibility of health care. Nobody's got any disagreement on that.
That's right.
There are ways to do it. I mean, tort reform would be one way to reduce the cost that gets built in, whether it's defensive medicine, whether it's doctors having to pay huge insurance rates to provide. That's not included in this. Cross-border purchase is not included. There are a lot of ways that you can do this plan better than it was done. The question is, do you pull the whole thing and start over, or do you try to build something new on a bad foundation? I guess that's the fundamental disagreement.
The fundamental disagreement is whether or not it's a bad foundation. And as you know, Tennessee Citizen Action is a consumer rights organization, and we don't think it's a bad foundation because it's got plenty of consumer protections that are already working now for Tennesseans in it. And so the foundation is there.
But
so
there's no taxpayer protections. I mean, there's a $750 billion tax increase as part of this deal. That's not a taxpayer protection.
Well, we can talk about whether or not this is a deficit-neutral bill. I mean, I think the way we need to look at it is Democrats say that it's deficit-neutral. Republicans say that it's not deficit-neutral. We have the Congressional Budget Office, who, of course, you have heard the numbers spun one way, but the Republicans are actually targeting. Sorry, didn't mean to use that word.
Yeah, be careful.
Sorry,
don't kill anybody.
No, they're actually, looking at those numbers and
the hate speech we get from the left, Mary. You guys just can't help yourselves.
They're the scorekeeper, right? So they're Republicans are looking at the CBO and saying no, but we have to remember the CBO pretty much killed the Bill Clinton health care plan back in the 90s
because they gave accurate figures of what it's going to cost.
Right, and what they also did was they held Democrats accountable during this process by giving them, numbers that made it a more fiscally responsible bill.
But even the Democrats have stopped saying that. They said during the election, quit saying it's going to save money. It's going to cost $540 billion. And the reason it's going to cost more is they tweaked the numbers. They lied about the numbers, Mary.
Well, let's not have a debate on this because we're going to go back and do a he said, she said on the numbers.
But part of the truth is that they counted 10 years of revenue to fund 6 years of the program.
Hey, can we go back to the part we agree on, which is we all want to have health care?
The numbers don't add up, and that's the problem. You've got to get to the reality and the truth. The numbers don't add up the way they said.
To you
it's
and to some people, but to the Congressional Budget Office, they
tax
do.
Increase.
The
Congressional Budget Office says they don't. Watch what Congressman Ryan does is he dissects what the CBO did. They double-counted savings and undercounted cost to give the Democrats the numbers they wanted, and they've revealed that with the doc fix that was part of it.
We all know they can spin numbers just any way you
true.
Want. You can spin poll numbers, you can spin Congressional Budget Office numbers.
Let's
talk about the 32 million people. This is something that the degree to which covering 32 million people get ignored in the health care.
The 32 million is not true because you've got illegal aliens included in
It's embarrassing the way we're not talking about any number of people that are going to get insured, that aren't insured now or underinsured
if
now.
It's 5 to 6 million people, we ought to focus on that. But it doesn't cost $1 trillion to provide health insurance to 5 million people under the guise of taking care of 15 million illegals. If we've got 5 million people who need health care insurance assistance, it doesn't cost $1 trillion to do that.
You cannot in the bill, you cannot get coverage unless you have proof of citizenship.
But then they don't fund looking for the proof of citizenship.
Well, that's a whole other story. Look, I agree with you. There are things that need to be.
Barack Obama's illegal alien aunt wasn't supposed to be living in public housing, but she was.
Are we talking about health care?
We're talking about what they do to cover illegal aliens and keep them from being in. They will be included in this, just as they're being included. The Los Angeles County just reported that they are spending $600 million a year on welfare for illegal aliens. They're not supposed to be included, but that's $600 million a year that Los Angeles County is spending on people that you say, well, they won't be covered because we have a provision that says don't cover them. That's $600 million a year that we're paying.
We're looking to cover, as executive director of Tennessee Citizen Action, which is a public interest in consumer rights organizations, we're trying to get affordable and accessible health care to as many Tennesseans as possible. That's what our mission is, and that's what we're going to work. Now, we can talk about whether or not this bill is perfect, and I don't think it's perfect, probably for a different reason than you don't think it's perfect. We can move in the right direction. Repealing the whole thing, though, is not the right way to do it. There are foundations in this bill that are already taking place, consumer protections, that are already benefiting Tennesseans. That's the reason why we need to keep it in place while we're working towards maybe fixing some of the things like the 1099 small business 1099 requirement, right? I didn't know about this until very recently. That's an undue burden to put on small business owners. I agree with you, and it should have been repealed, or not repealed. It should have been changed.
But if you involve people
so
on
let's
both,
look at those things.
But if you would involve people on both sides of the aisle in crafting a health care reform system, rather than what the Obama administration did is say, we won, you lost, nanny, nanny, boo-boo. We're going to shove it down your throats without reading it, without any...
If that was the case, we would having a single-payer health care system. Woohoo!
Well, that's what their goal is.
Don't.
Wait a minute.
No,
I thought you said at the outset, Mary, you weren't for government-run health care system. A single-payer plan is a government-payer plan that is government-run health care.
Wait, what I'm saying is that we need to insure as many people that are uninsured
No, what you just said is that you're for a single-payer plan.
Well, no, I said woohoo. I didn't say I was for a single-payer plan.
Well, then why would you be cheering a plan you're against?
I said that if they had shoved it through...
Are you for a single-payer plan?
If they had shoved
Not
it
as
through...
executive director, are you for a single-payer plan? You just woohooed it. Is that a verb? Can I make woohoo a verb?
You can.
You woohooed it.
It is so a verb. That's a really interesting question.
Well, Barack Obama's for it. His advocates have put together this planner for a single-payer plan, and his advocates who push this through say this is the way to get there because they're going to destroy the health insurance system.
No.
And
they're
then we
not
have
going to
no
destroy
choice.
the health insurance system. Actually, they're going to make the health insurance system better. Let's talk about how they're going to make the health insurance
We're going to have to do that some other time because we got 1 minute over because you were too busy woohooing to get to the facts.
Yes.
Mary Mancini. See, you're never going to come back again now, are you?
Did people just hear what he just said, or did he just...
No, that's just in your ear. You're hearing voices in your head. Again, hate speech, voices in her head.
We didn't even talk about Steve Cohen.
I'll give you 30 seconds on Steve Cohen, the vile,
the only ever time that you should talk about Hitler and the Holocaust is when you're talking about Hitler and the Holocaust.
I'll agree with you on that one.
I know.
I'll agree with you on that one. Mary Mancini, it's fun. We'll get you back on.
Thanks.
Go to tnca.org. tnca.org. You'll find out more about the Tennessee Citizen Action. We're back tomorrow, and we got Ellen Ratner coming in for Crosstalk, Larry Woods talking the vote. A lot of good stuff for you tomorrow, and we will be back then. In the meantime, go to gillreport.com.